Hi, everyone. My name is Maya. This is my first webinar, so just know that I'm a little nervous and we may just do cut to a scene with me on the floor crying, but we'll make it through. So, I want to talk about Botox today, just kind of the basics, reviewing what it does, who it's for, all of those things. We'll try to answer some frequently asked questions. And then also in the chat, if you have questions to ask and we don't get to them, we will send or we will post something with the answers to those questions. So, I want to talk a little bit about how you age or how your face ages through the different decades and where Botox might fit into that aging process or stopping that aging process. So, when we're in our 30s, we start really seeing facial lines that are created by facial movement, but they are staying there when we're not making facial movement. Really subtle changes, but we still start to see that as you age, there are more changes that are happening underneath the surface of the skin that we really don't see until we see the results of them. So, we're losing collagen and elastin. Um, there are fat pads underneath the surface of the face that are separating and shrinking over time. So then you start to see more creasing, maybe a line that goes through your cheek here, or starting to just have some volume loss. You may start to see jowls in the 40s. And then in the 50s, more of the same, but also bone loss is going to contribute to how the skin lays over the bone. So at that time, you start to notice more sagging and drooping. And that's when I think people feel that most of their volume on their face is in the lower portion. Um, I want to talk a little bit about benefits of Botox. So, what's nice about it is it's definitely quick and convenient and easy. You're in office for a very short period of time. There's no really, there are a few little restrictions, but nothing as far as aftercare goes. So, what it's designed to do is to soften the fine lines that are created by facial movement. Um, like I said, it'll be a pretty quick treatment. Botox is very safe and probably one of the most studied drugs. Uh, its safety and efficacy has been studied for a really long time. So, just in the cosmetic arena, we've been using it for a long time very safely. Um, and I think just overall appearance of the skin is going to look better as you don't have those lines from facial movement. Um, so it can also prevent lines from forming. So if you're starting it early, that's where we're kind of taking a preventative approach, taking care of those facial movements before they do create the lines and creases. It will just give a nice softer aging process, I guess I would say. So those signs are slowed. So what is Botox? People want to know. So it's a drug. It's a neuromodulator, um, and it's administered by injecting into the muscle. So we're blocking nerve signals. So although you're making all of the facial movements you've always made in speaking or whatever you're doing, the results are you're not going to be able to make those movements as severely, I guess, as you used to. And it'll make them relax very quickly after the movement. So then the result is smoothing of those lines. So we kind of talked about preventative in the early stages and more corrective in the later stages. So if you don't start early and you come with lines that are etched without facial movement, We absolutely can address those. It just may take a few more treatments to get to your desired result. So, a lot of questions surrounding dosage. Uh, what I usually say mainly is dosage equals duration. So, we want to dose you appropriately to get you to your next visit. We want you to come no sooner than every 3 months. And I would say a 3 to 4 month window is kind of what you want. So when you are getting treated, the number of units or the dosage that we're using is designed to get you through that period of time because you want to spend more time without the aggressive movements than time making the movements. And like I said, 3 to 4 months maybe is the duration. You'll start to notice the effects within 2 to 14 days, and you can expect those effects to last you that amount of time. And it's not a severe effect, and it's not a severe end to your treatment either. It's kind of a curve. So it starts taking effect. You really realize the best results from it probably a month in, and then it just slowly starts to the movement all starts to come back. So things to do or not do post Botox treatment. Definitely recommend doing a follow-up visit and checking, looking at photos, things like that, kind of looking back to what improvement you're getting. Definitely follow post treatment instructions. You want to keep the area clean after your treatment. Uh, Also, as I said, it can take up to 2 weeks to see a result. So be patient with those, and then we can check in at that point. Things you don't want to do after would be strenuous exercise, pressing or rubbing the area. You want to avoid excessive heat, alcohol, and I would recommend staying away from any facial treatments or massages or anything that's going to put pressure on that area. So, another question we get a lot is about possible side effects. And some are common and some are rare. So, a headache, that I would say not common, but it can happen, usually lasting about 1 to 3 days. If you have a headache that's lasting you longer after your treatment, definitely let your provider know, and there may be some adjustments we can make in the future. Possible bruising at the sites of injection. These are very, very small little bruises. They may not even be noticeable uh, to anybody but you, and probably can easily be covered with makeup. It doesn't happen all the time, but it can. Heaviness in the eyebrows or extreme lift in the eyebrows. So that can definitely happen, and that can be modified by how we make your treatment plan. So some of those things are avoidable and treatable. I do think that oftentimes the heaviness in the brows gets mislabeled or just as a eyelid droop, which is an eyelid ptosis. It's a very rare complication, but it can happen, and there's no formula for it. So again, it's very rare. It's a true medical condition and is treatable. Okay, so I'm back to a couple of other frequently asked questions. So how often do I need to come for a treatment? I would say every 3 to 4 months. Will I get the same treatment every time? In the first couple of visits, that's where we are making a plan for you, checking in at 2 weeks. How did it work for you? Did it address all of the issues that you were having? All of that. And once you get to a treatment plan that is good consistently, you usually stay there for a while. The dosage and visits don't vary that much. Does it hurt? It's not the best thing you'll do in a day, but it really is it's very minimal. These are really tiny needles, very few pokes. You're in and out of here in a matter of minutes for the actual injection portion. So a little tiny bit, I guess I would say. Another concern of people would be, will I look unnatural or unlike myself? No. And I can tell you the reasons why sometimes that happens. But in general, our goal is to keep you looking very much like yourself, very natural, just a little refreshed and younger. So the areas that typically get treated are between the brows, around the eyes, and on the forehead. So my best suggestion is to make sure that all of the areas are being treated, and because all of those muscles work synergistically, and with one there's an opposite. So in treating the whole area, I think that gives you a really nice balanced look, and it does keep you looking natural. How long does it take to see results? I would say 2 to 14 days. So, give it the full 2 weeks. Things can happen and change during that time. You may feel it working faster, but I would give it the 14 days to see what the actual outcome will be. And another question, is Botox only for women? Absolutely not. I think men care about how they look just as much as women do. Not that they know how to address the problem. We're more proactive about finding out, asking our friends, what do you do? So if you do have a man in your life, you can be the educator for them. Here are some before and afters. This one is showing just the horizontal forehead lines and what she looked like after treatment. This one, I think the area between the eyebrows is where she got improvement. We've got a little, I'm not even going to call it crow's feet. That's just a crow foot. Very tiny, but you do get improvement. And here we have some of the lines that are created by bringing the eyebrows in and down. And then she was relieved of that after treatment. Same area in this picture. And these are more horizontal lines. So we do have a special today that I'll tell you about. And also there is a raffle prize for the attendees. Our special for the webinar will be, if you purchase 100 units of Botox, you're going to get $150 off. Purchase 200, you will get $200 off. Purchase 300 and you will get $300 off. And these will be used throughout your treatments. We will save them for you. We will make a good treatment plan for you so you'll know how long that will last. And the base price will be $14 per unit. So if you do want to take advantage of this special, that would be something you would want to purchase today, and no other offers, no other discounts or anything. So I wish you all luck on the prize. I really would love to meet any or all of you. Having a consultation is a great way to start. I'm working out of the Paradise Valley location, so I look forward to it. The cosmetics line, you can either do cosmetics at cleardermatology.net or call the number for the cosmetics line specifically, and we will get you in. It is time for our live demo. So I'm going to shut the camera off just very briefly, get our model situated, and then we'll be back on for our live injection demo. Thank you. for the live demo, this is Nadia, my beautiful model, and I have prepped her. She's all ready to go. I even marked the spots where I'm going to put the Botox. We'll do a few of them on camera, rest of them off, and it will try to get to some of the questions that were asked in the chat after the first portion of the demo, see if we can get through a few of those. The ones we miss, we will do a follow-up post with answers to all of those. So for Nadia, we're doing all of the areas that we talked about, plus we're going to try a little bit above her lip, just for lip lines that may want to form someday. So on the top part, we're going to do her forehead, and I marked a few spots here. This is the area between the eyebrows. There are a few muscles that we're working with there, so we need multiple injection points. We're going to treat around the eyes. So let's get started. I'll just clean off our little dots so I'm not injecting through those. I'll have you turn toward me and raise your eyebrows just a little. Yes, and relax. You will get little bumps after your treatment, just where we were putting the Botox, totally normal. They'll resolve in about 10 minutes. Just a few more and we'll be done with this demo portion. And one more. All right. So my beautiful model is just going to get to sit there and relax for a minute while we try to answer some questions. And we'll finish her up.
Absolutely amazing. So our first question is, what age is considered to be starting early?
Oh, I'd say in your 20s.
Okay.
Yeah, early 20s.
And then someone asked, I have deeper wrinkles across the top of my forehead, and I was wondering if I get Botox to stop raising my brows, will that help?
Yes, yes, that will help. However, if you're coming in and the horizontal forehead lines are the only thing you're concerned about, I would probably not want to treat just that area by itself because of the synergistic properties of the muscles, and that, we want to treat something else that's going to prevent what treating one area can do. So we would discuss that.
Perfect.
Yes.
Someone asked, what is the difference between Botox and Dysport, and do you offer both?
We do offer both. The difference is it's in the manufacturing process, really. All the neurotoxins that are on the market now came after Botox, which was the original one. So they're all the same drug, just different manufacturers. They may have differences in how you're supposed to inject them, but for the consumer, no, there are really no differences. And I always say 2 to 14-day onset and 3-month duration.
Perfect. And then someone did ask, what is Xeomin?
Okay, that's another neurotoxin on the market, another manufacturer. So same thing.
Perfect. Got it. And then someone did ask, is there any numbness after treatment?
There shouldn't be. I feel that maybe you may feel that. Sometimes it's cold going in, so it might feel a little strange sensation from that. And no, you feel like you are using all of those muscles. You feel very natural. It's just not doing it like it used to.
Perfect. Thank you. And then I see one more question. What are units, and how do I know how many units I need?
You don't need to know about how many you need. So units is just a measurement of volume. It's injected as a liquid. So that's how we're measuring how much medication is going into the area. So standard dosage, though, I would say between the eyebrows, 20 units. Forehead, 10 to 20. Around the eyes, 12 on each eye, but you can go lower depending on where you need it, what you're looking for. So yeah, and we would talk about all of that and what's appropriate for you.
So it really just depends on the patient, how many units they need. It's very
Exactly.
personal.
Yes.
Got it.
Yeah.
Awesome.
So like, yeah, if your friend gets 20 units and that's good for them, that may not be the treatment for you. So we would definitely talk about that.
Perfect. Great. It looks like that's all I have for now.
And I'd be happy to answer any other questions or do a consult or see you for a visit. I look forward to it. Oh, I wanted to tell you one more time about this special we are offering. So we got, if you purchase 100 units, you can get 150 off. 200 units, $200 off. 300 units, $300 off. The base price for Botox is $14 a unit. And so for this special, for webinar participants, it just has to be purchased today. Thank you.